Hello and welcome to the day three of 3-day APAC HealthTech Innovation Conclave. We are in a very important session. Just to take you through, we had a wonderful inaugural session on day one with the chief guest address by the health minister from the state of Chhattisgarh, Shri T.S. Dio Singh ji, and we also had representation from the government of India, Director General Neeta Verma, who is the NIC Director General, National Informatics Center, Government of India, and we also had policymakers who are the principal secretaries and national health mission directors from the state of Kerala, from the state of UT Chandigarh, and several other states, including Mizoram. And throughout, we had some interesting power-packed panel discussion and also wonderful technology presentation by those uh, from the healthcare industry, and we had global leaders as well as national speakers from across the country. Now we are at a very important session that would be focusing and revolving on the care with empathy and passion. So, to do the honors, we have eminent speakers from across the from healthcare sectors from across the country. Do join me in welcoming them. Uh, Dr. Aloke Mullick, who is the Group CEO with the OMNI Hospitals. Thank you very much, Dr. Mullick, for joining us. We are also joined by Dr. O.P. Yadava, who is the CEO of National Heart Institute. Thank you very much, Dr. Yadav, for joining us. We are also joined by Dr. Chandrika Kambam, who is the Director, Clinical Services at CG Group of Hospitals. Thank you very much, Dr. Chandrika, for joining us. And Dr. Vijay Aggarwal, Head Medical Services, Motherhood Hospitals. Thank you very much for joining. And we're also joined by Sonymol K, who is the Chief Nursing Officer with Aster Medcity, Cochin. Thank you very much, Ms. Sonymol, for joining us. So, with this, just to give a brief, this session would also, the key discussion points would be increasing patients' satisfaction by ensuring empathetic approach by the caregiver to the health users, and empathy and compassion, which helps in building trust and cooperation between healthcare professional and patients, influencing factors for empathy. So, to do the honors, we have a wonderful speaker, Dr. Aloke Mullick, who is a Group CEO of OMNI Hospitals. Dr. Aloke, over to you.
Hey, thanks, Sudhir, and welcome to all these eminent panelists. And I still remember a year ago, I was talking to the APAC guys, and I said, "You guys create such wonderful conferences, but nobody discusses empathy and compassion." And the idea came to me because I so strongly felt it is such an important part of healthcare, such an important part of healthcare. So much so that overseas in US and all, there are big training gigs, which multi-million dollar training gigs, which train healthcare givers on compassion and empathy. A big study, which is a private study, that can't be quoted by name, by one of the top 4 consulting companies amongst one of the top 3 hospitals in India. They asked a question from 3,000 patients. How was your experience in the hospital? This question was asked 3 times. Once was while they were admitted, once was at the time of discharge, and the third time was 2 weeks later. Now, while they were, the response while they were admitted and while at the time of discharge, the response was, oh, the tea was cold, and this report was delayed, and the admission was so tortuous, and the discharge took so much time. Typical operational issues in a hospital. But 2 weeks later, more than 90% of them, they did not remember any one of the operational issues. The only thing they remembered 2 to 3 weeks later was, oh, the nurse was so kind, but the doctor never had time for me, or a version of that. The only thing that the patient remembered was the quality of human touch points. And if the quality was poor, he remembered it. That makes that person make repeat buying decisions. He knows that this place did not treat me kindly. They did not treat me like a human being. It did not treat me with empathy. People were rude. People were brusque. Doctors treated me just like, I'm not a patient, I'm not a human being. So were the nurses, so were the, you know, and so we started a big program in our own hospital on training soft skills to our staff, on telling them that if you're kind, I will reward you. If you're rude, I will punish you. Okay? And so the mantra for all my staff members, whether from nursing or from medical or for any other streams which are there in the hospital, is make 5 people smile today. Really, really, show them empathy and make 5 people smile today. And it's a culture change. We all know how it works. Unfortunately, in India, you see a lot of empathy and kindness in the villages, but the moment you come to city, it changes. I don't know why it changes. And for those of us who have worked outside the country, in Europe, in US, in the Far East, when you come back to India on leave or something, and the rudeness in the society strikes you. People shouting at each other, people screaming at each other, people screaming at a waiter just because you have paid for the food, people screaming at a nurse just because they're paying for their bill. All those kind of things are happening. And the nurses also screaming back, the doctors also being unkind to the patient. So it's there in the culture. And the more you change it, the more the patient loves you. More the patient loves you. There's so many stories. Any doctor will tell you that the patient will come and tell him, okay, sir, I want to get treated by you, but can you operate on me in some other hospital? That's the patient telling you, this hospital has never shown empathy to me. Your housekeeping staff, your nursing staff, your porter, the way he corresponds, the way he treats your patient decides whether this patient is ever going to come back to you again. Any finance guy will tell you that if you are able to retain 10% of your patients, like you have 100 patients today, and only typical, we track our metric calls patients return rate. For good hospitals, the return rate on a blended across specialty should be around 30 to 40%. For most hospitals, you will be surprised, it's close to 10%. Close to 10%. You add another 10% to this, you actually add 30% to your top line. And this is patients who are already in your system. You don't have to go and spend marketing dollars to get those new patients. You don't have to spend money. These are patients who are already in your system. You somehow manage to upset them just by not showing empathy. So that is why I think this is a very important thing. As human beings, we know that if we are empathetic, if we make the day for a patient and get a smile on his face, it makes us feel nice. It makes us feel more complete, right? And at the same time, it's good for business as well. So we'll start this. We've got a very senior panel, very distinguished panel. I wish there were more nurses here, because 80% of our care is provided by nurses. I'm sure we will have more colleagues of Sonymol in future panels. Dr. Yadav sir, you're a very senior clinician. You're well known for your own empathic approach to healthcare. What I would like you to tell us is, how has empathy in the treatment program for your patients helped your patients?
Well, thanks a lot. I think you have, in a large part, answered that question in your prologue. And the benefits are tremendous. Uh, we know it improves outcomes. It has been shown in randomized trials that when they divided the doctors into two groups based on the patient feedbacks, as doctors showing high empathy and low empathy, in diabetic patients, the metabolic complications were less in doctors who were more empathetic. So, hard outcomes, I'm not talking of those soft outcomes, hard outcomes. That's been shown. It's also been shown when empathetic doctors treat, the immune levels of the patient go up and vice versa. We also know that empathic doctor helps in reducing the anxiety level of the patient. And anxiety and psychosomatic disorders, they are plenty in the community today. In fact, even in the so-called more definitive objective diseases like coronary artery disease, cancers, there is an element of psychosomatic overlay, and you can allay that. Similarly, you can reduce errors. And even if you fail to reduce errors, the medical legal litigations go down. There is a wonderful study where the time taken for informed consent was much less when an empathetic doctor took consent versus sort of someone perceived to be not that empathetic. So, I can go on. The trust and satisfaction level of the patients go up. So, all these are very important positives which come out from empathy.
Yeah, that's a very interesting point you picked up about medical legal consents. We all know that hospitals will have problems. Any surgeon who says he never had a complication has either not operated enough or he's lying, right? So, but patients react differently to different surgeons. If you're a surgeon who are not perceived to be empathetic, not perceived to be open, not perceived to be kind, patient will sue you. Definitely, he will sue you. But on the other hand, if you have always been open to the patient, you've always been kind with the patient. I had a patient, and one of my juniors were operating, and both the recurrents got knocked off in a thyroid surgery, right? And the lady lost her voice for life, but the patient said, it's okay, doctor, you tried your best. So this is the response, right? If I was perceived to be a haughty doctor who never had time for the patient, this patient would have reacted very differently. It's so important. So it is like, as you said very rightly, sir, it is so effective and powerful. It builds patient trust, it calms anxiety, and obviously it improves the health outcomes. So many researchers have shown that empathy and compassion are associated with better adherence to medications, decrease in malpractice cases, fewer mistakes, and increased patient satisfaction. All these things are standard, but I don't know why Indian hospitals are not focusing on empathy as a metric amongst their staff and doctors. It's time we started doing that. You heal more people, you have happier patients, you have more business. If the CEO is happy, the CFO is happy. It is such a no-brainer. In one of my hospitals, we had 1,200 OPD cases per day, big hospital. We did a study. I said, okay, I want to know how many of these are new patients, how many of these are repeat patients. We had 300 new patients every day, 400 new patients every day, and 800 repeats. We said, okay, let's analyze the repeats. When we started analyzing the repeats, we found that the repeat rate over a 3 months period was 10%. Even for chronic specialties like rheumatology and diabetology, the repeat rates were like something 35%, where you expect a 70% repeat there. Something was seriously wrong. And it showed when, moment a patient walks in, you see the front office girl who is sitting there. Moment she sees a patient, even if she's not doing anything, she will start looking very, very, very serious in the computer screen, as if she's very busy. instead of smiling at the patient and saying, "Good morning, sir, welcome to National Heart Institute, and how can I help you?" She can always say that. She doesn't say that. That's not part of the culture. Okay. It took me 3 months knocking on the head of every front office girl and boy that you need to smile at the patient and you need to welcome them. Okay. It took me 3 months for them to start smiling. And when they started smiling, they never stopped. I asked them, "Now you are smiling so openly. How come it is so simple to you, which it was so difficult earlier?" She said, "Sir, I realize that when I smile at the patient smiles back at me. That makes me feel very nice." Okay? A smile gets a smile. You spread smiles. And my patients who are from my friends who were coming to my hospital, they said, "Something you have done. Everybody is smiling these days." This is just starting. The culture of smiling makes such a big difference. And our 10% repeat rates that started becoming close to 20%. And our OPDs went up from 1200 to 1500. You see the business value of all this. Everybody is happy. The investor is happy, the doctors are happy, the patients are happy, and the nurses, they are now suddenly, I tell you another small example. We had a hospital where there are 200 beds for the poor patients, where all these government scheme patients were there, and the other beds were for the paying patients. The nurses used to feel that if you're posted to the poor wing, it's a tragedy. You're being demoted. You're the worst in the lot. That's why you were posted in that doghouse, right? I one day called them. I said, "You're in the rich wing when you are working. Every patient is shouting at you, screaming at you. In the poor wing, the poor patient, you just give him his medicine, whether you give it on time or not. In the rich wing, even if he keeps on looking at his watch, even if you're late by 10 minutes, he'll shout at you, right? That's the Indian culture. Everybody shouts at everybody. But in the poor wing, that patient will have tears in his eyes when he becomes okay. He will touch your feet and he will go back and he will bless you and he will tell you that you have my blessings. My blessings are for your children." And the nurses said, "Yes, sir, that is so true." Then they started lining up. "I want to work in the poor wing." You get it? So, Dr. Vijay, this is what has been your experience with empathy practically? When you must have seen people, just share your experiences. You must have seen people who are non-empathetic, you must have seen people who are empathetic, and how teams which are more empathetic. I mean, I can tell you hundreds of stories, I'm sure, and that's why this is a forum just to share our stories. So tell us something about what has been your experience with health caregiver empathy. When I mean caregiver, I mean everybody in the spectrum.
My experience, what I feel is in medical colleges, especially nursing and doctors, we are taught the technical stuff. And general perception in our medical colleges, keep your emotions away. If you want to become a good doctor, you should be technically good. And when you, in real life, when a patient walks into a hospital or walks into a clinic, patient has multiple needs. His health wise, he needs a doctor to help him because there is some problem with the body, the health requirement is there. Second is emotional need is also there. He wants a compassionate person to talk to him. There is emotional need, somebody should reassure him he'll be all right. And even if clinical outcome is not not good, like some terminal diseases like cancer or a disease which is going to stay with you forever, the acceptance to that bad clinical outcome needs lot of emotional support. So that requirement for emotional intelligence in a doctor is not yet perceived by the medical fraternity at very basic educational level. So we feel all these things when we are into business. We see, okay, for retention of patient, because of competition, because of various other factors, and now because the patient is paying, patient is demanding. So we should be compassionate, or we should be emotionally intelligent to understand patient's emotional needs or to understand what patient is going through during the disease process. So it's like, I think our basic education system is lacking here. So it should be one of the, one part of the curriculum of medical education. You know, like in Western world, we have breaking the bad news, or a conversation with the patient is one part of the exam. Here we see how good a person is, how good a medical student is in reaching the diagnosis. Okay, during that thing, if he is very good at answering whatever is written in a medical book, even if he was rude in the conversation, he did not deal with the patient properly, it is never taken care, never even addressed. The brightest students
See,
in medical colleges who score very good marks in the exam, an exam doesn't have anything to do with compassion, empathy, or anything like this. So the basic DNA of the doctor and the nurse is nursing. Still, I think I shade better than doctors. Uh, Doctors is, if it's okay to be rude. I mean, since all of us are doctors, and I like a typical scenario in a medical college, how it happens is morning the junior most doctor is an intern or a first year PG is doing all the hard work. Overnight he'll be awake. Morning, a senior professor, unit head comes. What I feel, my experience is, one of the 90% of his job is, scare everybody. Everybody should be scared of him. So from that kind of environment we come, and we are expected to be compassionate with the patient, empathetic to the patient. How does it come? It should be in our DNA to, work towards it. So what I feel is, if we really want empathy in healthcare, we really want doctors to be compassionate, it should be at a grassroots level. It should be at, very, the our medical curriculum should have it as a chapter. And when we are assessed in clinical cases, especially in final year, this also should have some marks or some way of assessing it. That's what I feel when it comes to compassion and empathy. When already the person has spent 10-12 years of his life practicing something, and then expecting a person to change the culture and work towards it is slightly difficult, I feel.
yeah, you hit the nail on the head. I mean, it is sorely lacking in our medical education system. Absolutely, I agree with you. And there's so many stories I hear. And we have a lot of Indian doctors working in the Gulf, and a lot of my friends are non-doctors who work in the Gulf. He said ki we quite often prefer, though we know the Indian doctors are better professionally, but we find that the Egyptian doctors or the Jordanian doctors are more kinder. So if I have a serious illness, I go to the Indian doctor. If I had a normal illness, I would prefer to go to an Egyptian or a Jordanian doctor because he's kinder. I see the kindness in them. We feel the kindness in them. It is such an important thing. I will try and there was this wonderful video somebody suggested. I play this in all my, for the sake of the audience. See if I can play this. Um, I think it was Dr. Kambam who suggested this video. Thank you. So that was an amazing video. I mean, I love this, and I get tears in my eyes whenever I see this video done by the Cleveland Clinic. They have a big compassion training program within the clinic, and this was created for their internal usage for their own training program. Somehow it found its way out and became international hit. So yeah, absolutely, I totally get it that this should be part of the curriculum, but since it is not, and and the way curriculums are modified in our MBBS system, it takes time. But empathy can be taught, right? So I myself run a lot of empathy and compassion training program across so many hospitals in Hyderabad and Pune, and people come back with tears. They said, "Wow, I never thought I could look at it like this," you know. So Dr. Chandrika, you run the clinical program in SCG, and this is of course not clinical. This is more like emotional soft skill. So would you be planning to do a training program, or what do you do? I mean, we always know that see, these many doctors are a problem. They lots of patient complaints from them about their behavior, and these many staff from the clinical side, from the medical side, they're a problem. So how do you tackle that? How do you go about doing that? Doctor making clinical mistakes is easy to handle, right? But a doctor making emotional mistakes, how do you handle that?
Good afternoon, everyone. Thank you, APAC Healthcare Network, Technology Network, for organizing this conference and inviting me. And thank you, Dr. Aloke, for that question. I think, like everybody said, empathy is an important part of our of our work, and it has to be interwoven like a fabric of the hospital healthcare delivery system. And there is no two things about it. But how do we implement it at the hospital level? It is a culture. It has to be driven from the top leadership till the grassroots level. Every day we have to talk about it, and every day we have to show it in our actions, and build it into our induction program, build it into our soft skill training program, and keep emphasizing that every on a day-to-day basis, so that it becomes part and parcel of our work. Um, Definitely, the complaints from the patient of doctors, at least the senior consultants, not being empathetic, are very less than 0.1%. 1% of our patient complaints. But we would like to encourage the mid-level and the junior level doctors to come up to that level. So what we have done is, in our academic programs, we have role plays, we have soft skill training that we organize. Role plays work the best for empathy training, because empathy is something that you cannot objectively tell people how to do, like objectively score it or explain it verbally. But when you show it in front of the junior staff, how a senior staff is taking care of their patient, and why one consultant has X number of patient, another consultant has X plus 1 or X plus 100 times more patient. The difference between the two doctors having same specialty and same type of training and giving same services is the way how they handle patients on a day-to-day basis. So I keep giving them examples. Watch them how they talk to the patient. Watch them how they approach their problem. Watch them how they make them feel comfortable. So those are all the characteristics that you have to imbibe yourself. And the difference between an average doctor and a great doctor is not their knowledge level. The difference is how they handle the patient issues and how they solve their problem. And there is a study also which is shown that a doctor spends the same 5 minutes time with the patient, and one doctor is sitting next to the patient, holding hands of the patient and talking to the patient and addressing their problem. Another doctor standing next to their bed and talking to the patient. When the patient was asked, "Who spent the maximum time with you?" The patient said, "The doctor was sitting next to me holding my hand, spent the maximum time, though both of them spent exactly the same amount of time. So it's all about how you make them feel. Even if you spend 5 minutes, at that particular point of time, you give complete attention to the patient and nothing else matters to you at that particular point of time. And he is the only person that matters to you. That is all you have to do. Because as we become very familiar with our subject, it is very easy for us to diagnose. It is very easy for us to come up with differential diagnosis, and it is very easy for us to implement the treatment plan. So that is anyways given, and it is running in the back of our mind, and it is something that we can do without even looking at anything. But the difference is that even if it is the hundredth patient, you are treating him as if he is your first patient. So that is the difference. So that journey is what makes all the difference, and for a good doctor to a great doctor. And that is what we are trying to inculcate by giving examples, by showcasing it, by doing workshops, and by kind of doing role plays, and also observing how some doctors have become great, and what are the nuances that they do, how they manage the patients. So learning from practical point of view. So these are some of the things that we are doing in order to bring this culture at junior doctors and mid level level doctors.
That's amazing. I mean, you talked about doctors touching patients. Suddenly is going away. I mean, I heard a joke recently. How do you know the cardiologist has been trained in Britain or trained in America? So the guy who is trained in America won't be carrying a stethoscope. So, Doctor Dr. Yadav sir would be able to comment on that. But there's another beautiful. I don't know how many of you have seen this. There's another video I would like to share on why how consultants' behavior affects their patients. Let me just show this.
I left England in '89 and I started working in a hospital in Calcutta. And those days there were no mobile phones. And we used to have a land phone line connection in the operating room. And when I was in the middle of an operation, my anesthetist took a call and he told me that some patient wants me to make a house call. And I politely told him that I'm a heart surgeon, what do I do at home? And then the caller insisted that I visit the patient, saying that it might perhaps transform my life. And that patient happens to be Mother Teresa. She introduced me to the power of simplicity, power of compassion, power of love. Like one of our very famous statements, which I have in my office, is that hand which helps are holier than the lips that pray. She is a nun, her job is supposed to pray, but she herself believes that helping other human beings is the best form to reach out to God. You see, the modern medicine has undermined the importance of touch and compassion on the face of a doctor. When a patient comes to me, he has done all the investigations. I know exactly what's happening with the patient. I don't need to put a stethoscope and listen to his heart and the lungs, but I do it. I don't need to touch him, but I still do it because the power of touch is phenomenal. The moment I touch the patient, I put my hand around the shoulders. That's very reassuring. I only have 5 minutes or 10 minutes of interaction. In that period, I have to convince him to undergo an operation by which he can potentially die. He has to make a decision. He has to trust me. I have to look onto his eyes, talk to him, connect with him. And that's very important. That has larger healing power than all the surgical tools and medicines I have in this world. But unfortunately, the whole philosophy of a touch, compassion, caring is gradually losing ground. It is a sad situation. I hope it gets restored.
So, so I now come to Sonymol. I mean, Sonymol, we will, nurses provide 80% of care to a patient. Lots of compassion or lack of it that the patient experiences in a hospital comes from the nurses. I've had some brilliant stories. There was a nurse in our pediatric surgical ward, and she used to hug the child before he go to the OT and say, okay, go, I pray for you that you come back smiling. The mothers used to feel so, enthralled. Here is this nurse who is more worried about my patient than I am myself, Later on, what has started happening, patients started looking out, कि when this nurse is on duty, that day I want to get my child admitted, when she is on duty. You see, my question to you is slightly different. Dr. Devi Shetty mentioned about Mother Teresa. Mother Teresa, of course, we know was the epitome of compassion. But Mother Teresa also understood that there is a thing known as compassion fatigue. You treat too many patients, too many sick people, too many suffering people, ultimately you experience compassion fatigue. And Mother Teresa had a rule that all the young girls who are working with her, every 1 or 2 years, they had to take 2 months off. They had to go back, they had to take a break. How do you manage compassion fatigue amongst your girls? Sonymol. I think you are muted.
Yeah, sorry. Thank you, APSC, for coming with a diverse topic for discussion. And thank you, Dr. Aloke, for the wonderful question. So I know the fact that the nurses are known for the empathy by virtue of their training, and also they are with the patients 24/7, always in the bedside. And training in the empathy in nurses, it is inculcated from the curriculum itself. In the 3rd year and 4th year of nursing, we are taught by the curriculum from INC, Indian Nursing Council. The book is saying about one whole chapter about and one full book about empathy, compassion, and how to do compassionate care to the nurse. So that is why the word is nursing comes from. So we all are compassionate for patients. But the problem in right now, the sad reality is saying that we have many indicators to assess our quality of performance in healthcare system. For example, if you want to assess about healthcare quality, we have many indicators to assess. And if you want to assess healthcare operations, again we have indicators. And if you want to assess our financial strength of an organization, we have the indicators to assess the EBITDA and PAT and RPOB of an organization. But we do not have a particular system in place or an indicator to assess the empathy, even though we are inculcated from the curriculum. And some of the hospital I know about, many of the hospital in the on-the-job training and the induction, it is already a part of their induction training, how we can able to give the empathetical care. In that, many of the hospital I know about that there is a system of SOP in which the nurses are getting adequate amount of off or maybe leave to come and rejuvenate and to look after the nurse. So that's what your question comes, how I can able to ensure. So leading a hospital which is having about 900 nurses right now with me, it's definitely a challenge for me looking at the era of pandemic and the client profile we are getting. Yes, of course. But it is again up to the organization and the leaders and the healthcare visionaries how we can able to inculcate a culture of empathy in our organization. If you know about our nurses are overloaded, definitely we can plan a flexible system for the assignment or maybe the routine their career. So again, there are some measures to overload, or we can have many of times in the COVID also, to overcome the challenge in this hospital, my own hospital, we implemented counseling session for the nurses. So when the nurses want to be more healthy, then the nurses can only get the others to be healthy. So that is the main principle of this. And we have the counseling session for nurses. And again, we do have a yoga session, some of the physical sessions in which the nurses can do some activities, recreation. So that these are the ways we are trying our nurses to focus on their strengths and the positive attitude. And we definitely believe that this positive attitude is definitely going to impact on the patient care. And it is impact on our patient care feedback. So nowadays, almost all the organizations in India is depending upon patient care feedback as a tool to assess our empathy and communication. As I said earlier, we do not have any other structured indicator to assess. So every organization is understanding that how much my NPC in the organization NPC and how much bad feedback I'm getting. That is the only credible tool right now we are assessing the empathy. So as a nursing leader, if I'm taking, so for example, in the induction training, I have included empathy and compassion as a topic. And the same video you have reflected in the Queensland clinic, it is a starting the topic of our discussion when we start about the topic. The video is very well known to everybody we know about. And these are, we are doing some of the things. And again, in the ongoing training, as we know about the nurses and the doctors will write about care plan. And the care plan we wrote is a holistic care plan, we said always. The holistic means it will include physical and psychological well-being of the patient. Not only the physical aspect nurses are concentrating, we do write about fear and anxiety of the patient as a nursing diagnosis. That itself reflect about how the nurses are, how much focus about knowing about the compassion and empathy aspect. We do have nursing diagnosis and alternative mechanism of ourselves to understand about how the fear and anxiety level of the patient as well as the psychological fitness. And we do have counseling sessions. First and foremost, for this everything, we want to make our nurses comfortable and we want to provide the comfort culture to the nurses.
Thank you. This is, of course, lot more can be done to improve the condition of the nurses. That can be a totally separate seminar by itself. But yes, a nursing leadership which is totally dedicated to get their nurses up to scale when as far as empathy and compassion is concerned is so important. Now you brought up a very important topic about you and Dr. Chandrika is about training, and Dr. Yadava, apart from being a clinician, he is the CEO of a premier institute. So, sir, if you can discuss how are we training our staff on being, I mean, as we know that we're trying to change the culture. We're trying to make them more empathetic. We're trying to make them, of course, there is a slight difference between empathy and compassion. I always have this beautiful example that your friend is sick and what is it? I mean, the difference between sympathy, empathy, and compassion. Your friend is sick, you send him a WhatsApp message, I'm so sorry you're sick. That's sympathy. You're just sympathizing, right? You land up at your friend's place and make a meal for him or do a head massage for him. That is empathy, because you are doing something actually for his sickness. Compassion is when you get tears in your eyes while you're doing the head massage. You're feeling his pain, you know. So empathy and compassion there's slight difference that you feel the pain that the patient is feeling. And one of the simplest things that I always tell my caregivers is remember what Jesus said. Though I'm not a practicing Christian, but I love a lot of those concepts. Do unto others what you like them to do unto you, right? If you see a patient, you think that this is your brother, your sister, your mother, your father, you know, how would you like him to be treated or her to be treated? the same way you should treat this person, right? So we have, I mean, we would like to hear from you, sir. What are the measures you think organization, at an organization, we are now talking management. We're not talking about doctors and nurses, we're talking management. At a management level, what are the things that we can do so that we can encourage this culture change? You know, as usual, management will do a carrot and stick policy. You do this, you'll get this carrot. You don't do this, you'll get this stick. So let's start with that, sir.
Well, let me start. Thanks, Aloke. That was a wonderful question. But can I make an observation on the previous before I come to the topic at hand?
Sure, sir. Sure.
Sonymol mentioned that there are no, empathy measurement tools. So there, I, beg to differ. There are a lot of tools, and one of the commonest tool used is called the Jefferson scale of empathy. It's a self-administered tool of 20 questions, and that's used the worldwide. And then there are multiple tools available. And Chandrika made a comment about, the seniors having 0.1% empathy-related problems. Well, I must compliment you. Believe you me, that's not my experience. I feel it is the power differential that a person doesn't report it. But if you look for it, then you will find that there is a major problem even with the seniors. So that's my observation. I don't want to enter into debate. Coming to your question, Aloke, of what we should do. See, Vijay mentioned that very, very elucidly and very succinctly that, look, the sensitization which should take place in the college is lacking, and that's one step. But we can't go back to college now. We have to handle what they are. So first thing is that we have to change the attitude of the institutions, because today we are providing entirely, and I speak for myself and I take no pride in that, a technology-driven, disease-centric care to the patient with a view to providing a cure. Well, actually, what is the need of the hour is to provide a healing touch, which should be patient-centric and not disease-centric, and it should be service-oriented. And with that technology-oriented care, empathy just does not gel. It cannot gel. They are absolutely antithesis to each other. So that is the mindset that the hospitals have to change. Corporate hospitals have a bigger problem than the, trust-run hospitals and the government hospitals on these fronts. Again, we have to provide more time. We have to, use methods that the nurses and the junior doctors, in my intensive care, there are about 38 parameters which they have to write every hour. And I'm accepting the blame that, look, nurses are just filling those parameters. They are only pumping fluid into this Swan-Ganz catheter and measuring the cardiac output and the cardiac index, are not able to put their hand and see there is a warmth of the distal perfusion of the limb is good, so the cardiac output must be good. So, that attitudinal change, I think, is the single most important thing which has to come to institutions to inculcate empathy. And thereafter, everything has been said: role model, role play, sensitization, all those things play their natural part.
I agree with you, sir. But as an administrator level, any measures that you suggest, any specific measures so that, say, for example, the first point of contact to a patient is a front office, to ensure that the front office is always smiling and empathetic to the patient in their interactions with the patient. That's the first point of contact to the patient. So what can we do about that?
Well, the first point of contact to me, Dr. Aloke, is the security guard at the gate.
Absolutely, agree.
Parking assistant in the parking, they are the first point of contact.
Yeah.
So HR runs whenever a person is recruited, and every 3 months they go through a small module of soft skills, which they run regularly, and it's a fixed soft skill development program And I'm sorry, but we don't work with punishment and reward, because we feel that may not be being empathetic. I would rather, know the reason for not being empathetic and help them change that reason and bring purpose to their thinking, rather than punishing a person for not being empathetic. And that would be a role model for me to play, because if I punish that person, then I'm not being empathetic to that person. So the very genesis of empathy is that I step into his shoes, as the video said, see what he sees, feel what he feels, and hear what he hears, and then decide why he did what he did, which I consider as non-empathetic. And either I change myself, that look, my judgment was wrong, or then I correct him. And that is the kind of thing, as an administrator, that you would like to do that. And secondly, as I told you, is that these HIS functions which medical staff have been given of filing all database entry is made by the junior doctors. All HIS entries are made by the nurses. So whatever little time they get from recording pulse and blood pressure, they are spending there. So we have certain data entry officers or data entry people who do these, and the nurses are not filling our database. In Indian Institution of Thoracic Cardiovascular Surgery, we have started a database for every case. We have to enter the details. 12 hospitals in the country have joined into that program. So we have a separate, a computer specialist who is the one who is doing the feeding, not the doctors, not the nurses, not the professionals, not the anesthetist. So I think we need to, give them adequate time to be able to spend with the patient besides sensitization. And that's probably what, as an administrator, I would like to do.
Very beautifully said, sir. Very beautifully said. But do you have a reward program for them?
Yes, I do. We do have.
How does it work?
Well, it works that there is a team which is constituted. That team is constituted for the entire year, and they are just roaming around in the hospital and observe in a unstructured fashion certain goodness which they appreciate, and that goodness immediately is picked up. And there are two ways. One, that the goodness, the director of operation, the director of nursing is entitled to give immediate there and then a cash amount and say to a person, a ward boy, you've done a wonderful thing. A person coming, old man carrying his luggage, he carries his luggage to him, opens the door for him, straight away pick out something and give it to him, or make a recommendation when they get this certificate and annual day function. Certain people are nominated for awards. So that reward is like any other thing. But most important is extempore, on the spot reward, for which they are entitled for giving a reward of up to 500 rupees to any hospital employee they feel like. And the hospital will reimburse it to the senior executive.
Yeah, that's beautiful. I mean, if I may add to it, we do a spot reward system, which is triggered by a manager or a specific patient compliment. Patient will sometimes give compliments by names. We also have an NPS driven system, and if he has given a patient has given a promoter score and he said the nurse was nice, and then somebody will do a detailing interview. So you would like to you remember any nurse who you felt was specially kind to you, she will take so and so nurse, so that the person gets a spot award. And if a person gets 3 or more spot awards in a quarter, they are considered for an out of turn promotion. So everybody knows kindness pays, So if you're kind, if you're smiling, we also have a best smiling award, the best smiling staff award, So and those pictures, they come up. They are big publicly visible notice boards. So these are the people who got spot awards for very good patient care. These are the patients who got the best smile award. And they know, okay, if they get more than 3 in a quarter, they will. We have promoted people from junior staff positions to assistant manager level position within 6 months. who are really there's some people who are brilliant smilers. They're very kind. They're by nature kind, you know. So they are the easy ones, and then everybody then knows कि हाँ इसने ऐसा किया तो they got out of turn promotion. So if I need to change myself, so you know, as you very rightly said, stick is not a good idea, but carrots are always a good idea. And but then yeah, we struggle with the culture. We struggle with the culture in which, in case of doctors, where doctors are told to keep your emotions aside. We all are reminded about that famous scene in Munna Bhai MBBS. Same thing, right? And by the way, Munna Bhai MBBS was based on an American movie, which was based on an actual story. And it's an amazing indictment of medical education all across the world. Let us move on to another part of this whole thing is, we have been also trying to conduct yoga and meditation for our staff, right? And we have found some very good results because of that. And so anybody, I mean, this is a round robin kind of question. Anybody can pick up this question. Anybody has tried yoga and meditation for their staff at a in their hospital, and what have been your findings on that? We have found people telling us when we started yoga and meditation classes, they said ki they sleep better, they feel more empathetic to the patient, they feel more kind, and they're less stressed. So all in all, they, and as Sonymol very rightly said, nurses are overworked. It's very difficult to give them time offs. But then what we do, Sonymol, is when we identify some nurses who are in a especially stressful position, especially like nurses working in a busy ER, nursing working in a busy ICU, we make it a point that the nursing lead has to give them time off. I said, okay, I will give you an untrained nurse. You have to take work out of her. But you have to keep rotating them, otherwise they will burn out very fast. And once you don't want to work with a burnt out team, right? So this is the question to all of you. If you have any experience with having yoga and meditation training for your staff at any level, whether it may be only for nurses or for doctors. Any answers?
Okay, if no one, yes,
Sir.
not present. I was earlier, before I came back to National Heart Institute, I was chairman of Department of Cardiac Surgery in Sir Gangaram Hospital in Delhi.
Sir.
And there the programs were conducted, and they were conducted by none other than Sadhguru Jaggi Vasdev,
Okay.
the big man himself. And I can speak for, and I attended those programs. Now, we don't have any formalized objective data that how it transformed, but certainly your own perspective changed. I can vouch for that from my experience, because I did that 7 days course of what was called inner engineering. The course was named Inner Engineering. It changed my own self. I found meaning and purpose to medicine, of interacting with the patient. And, generally there was a pep in the air, there was zest, there was lightheartedness. I don't know how to put it across in a better, language, or a flowery language, that I was, kind of flying, but it didn't last, much longer. The moment you finish the course, somehow I couldn't maintain the same what I was doing those 7 days. So
Yeah.
I'm convinced it works. But how do we keep it working for eternity?
You have to keep on following it up.
I have no answer to that. Maybe the rest of the panel has.
Yes, ma'am.
So you're right, doctor. So even we conduct a lot of yoga sessions, like learning Saturdays we have, and we do train them, and we do make them participate in that. But those are all transitory effect, and also difficult to measure in terms of their effectiveness. But I guess we need to keep doing something to keep motivating and keep that pace going. and keep reiterating the fact that empathy is the cornerstone of our business, and that is the only way to keep at it and keep going at it.
This is Dr. Vijay here.
Oh, Dr. Vijay, yeah.
So, like other hospitals, we also have trainings, reward programs, feedbacks from the patients, and based on the feedbacks, the employees are given appraisals, promotions, and all that. Uh, Along with this, we have one more program, which is basically addressing the culture change among the new doctors. So, what we do is we for our staff members, their children, anybody who wants to pursue medicine, uh, when they pass 10th standard, like general perception with all of us is, if you are good in studies and you want to become a doctor, you should become a doctor, write a medical entrance, or like choose a college and go to a medical college and study medicine. So what we want to communicate, it's not only your academic achievement, academic capability you should look for. You should understand a doctor's life, what a doctor goes through in his life. So what we have designed a program, it is called Budding Doctors, in which all the children who want to become doctors, when they pass their 10th, we have kept a criteria of 85%, but it's not very hard and fast rule. It's just to filter out, like we can't take everybody. These children can come to our hospital. They can spend a week with us. They are allocated in different areas. They are supposed to spend 8 hours there. They are supposed to shadow a doctor, observe what happens in their life, and when they decide to become a doctor, will they be able to sustain that kind of pressure, work pressure, emotional pressure, physical pressure. So so that they make a right choice. It's not it's a peer pressure. You become a doctor out of because with your academically good, the society expects you, or the parents expect you to become a doctor. You should understand a doctor's life. So what I feel is, this program was started with the intention that if you understand what your life will be after you become a doctor, so you'll be able to do justice with the job. It's not just earning money. Money is a byproduct of what you deliver. So this is one program which I wanted to share with you. I think these kind of programs can help people make a right choice. It's not only the marks, it's your physical strength, your emotional strength, which is required to become a doctor.
Oh, yes. I mean, most of us, whether it's doctors or nurses who have gone into clinical service, most of us have gone there with a service motive. But ultimately, because of the sheer volume of work that we see, the amount of cynicism we see in the society, the amount of discomfort we have with general social structures, we ultimately get burnt out. We ultimately ourselves become cynical, right? And as Dr. Yadav says, he felt a lack of cynicism, a personal connect with his patients while he was doing this program. And that is what we actually have also, because whenever we have run this program, we have done this along with benchmarking and a follow-up on our burnout scale. Now, we have a standard burnout scale, especially the Maslach burnout inventory, and we have seen consistent improvement in the burnout scale. And a staff member, whether it's doctor or a nurse, who is less burnt out is more likely to be empathetic. So, and this we recommend everywhere. Where you're running such a program, please benchmark your burnout numbers right now and see how they improve over a period of time. But then, as you very rightly said, sir, instead of doing a 1 week program, it has been an ongoing program, right? So, ongoing programs work beautifully, whether it's in a medical college or in a corporate hospital or in a small clinic. They work beautifully and great results are there. So, now I think Sudhir is going to come back. Yeah, we are close to 5 minutes more. So, I think he'll make some closing comments. Sudhir, over to you. You're muted.
If I have to put in a nutshell, the hands that help are holier than the lips that pray. This is the session, if we have to put it in a nutshell. It has been one of the most interactive session of this conclave that I can say, wonderfully moderated by Dr. Aloke. Very enriching and wonderful inputs and experiences shared by our esteemed panels. So, with this, I would like to thank Dr. Aloke Mullick, who is the Group CEO with the OMNI Hospitals, for wonderfully moderating. Thank you very much, Dr. Aloke. And Dr. O.P. Yadava, a Senior uh, um, uh, Health Specialist, CEO, National Heart Institute. Thank you very much, Dr. Yadava, for joining and sharing your views. And also Dr. Chandrika, Kambam, Director, Clinical Services, PG Group of Hospitals. Thank you so much, Dr. Chandrika.
Thank you.
Dr. Vijay, Aggarwal, Head Medical Services, Motherhood Hospital. Thank you very much, ma'am, for your views. And also, last but not the least, Sonymol, Chief Nursing Officer, Aster Medcity, Cochin. Thank you very much. We would conclude the session here, and we would be joined for another session with speakers, including policymakers and healthcare leaders. Thank you very much, each and everyone.
Sudhir, if I
Thank you,
can
everybody.
just,
Thank you, Yadav sir. We'll be in touch.
will be in
Thank
touch. Sudhir, if you can conclude it with a slide, take-home message for all the panelists. That is empathy. Empathy means E stands for eye contact, M is for your facial expressions, and P is for posture, and A is for affect, that is emotions that you show, and T is for tone of your voice, and H is for hearing patiently what patient has to say, and Y is your response to the patient. So I think that concludes on empathy and how we need to interact with patient. So that's an acronym very appropriate. And if they can practice it every day, then it can become a part. It can become our a part of the behavior. So I think with that we'll conclude the session. Thank you.
Absolutely, rightly
Thank you.
put, Dr. Chandrika. I saw Dr. Vijay raising hand. Would you like to?
हाँ सर, एक शेर है एम्पैथी पे, इफ कहूँ किस तरह मैं कि वो बेवफा है, कहूँ किस तरह मैं कि वो बेवफा है, मुझे उसकी मजबूरियों का पता है. थैंक यू.
वंडरफुल, बहुत खूब मैडम, बहुत ही
Thank you
बढ़िया
so much.
लाइन
That was
आपने
beautiful.
मेंशन किया है. Also, Dr. Chandrika. Thank you very much, everyone.